We're going to go ahead and get started, everyone. Welcome to Grand Rounds, live and in person from the Wellness Center. We're trying something a little different today because we're going to be talking about trying to take care of ourselves during the midst of all of the COVID stuff that's going on. So first of all, a little bit of housekeeping. For Grand Rounds today, you can see up on the slides, there is a new way that they're doing attendance and tracking for CMEs. So you're going to want to take the number 866-327-3062, put that in your phone because that's going to be the number you're going to be using moving forward for CME. And then you're going to text the attendance code 691780 to that number, and that will get you signed up for today's lecture. So if you have any questions about that, let us know in the chat function. But again, that's going to be the new way for doing attendance moving forward. So with the advent of all of the stuff that's been going on with COVID-19, we were talking about what are some things we can do to help ourselves a little bit in the midst of all the craziness and chaos that's been going on. And one of the things that came up was maybe we need to have a larger discussion about mental health and taking care of ourselves while worrying and spending so much time focusing on work. So Dr. Funda Bachini is going to be talking to you today about putting on your own oxygen mask first. And then we're going to be having Kristina Bignoli, who's from the Wellness Center, talking to you also. My name is Lara. I'm a pediatrician in the general pediatrics department, and I'll be moderating. And later on in the Grand Rounds, we're going to try a little exercise that I'll be leading for you. Dr. Bachini is one of the child psychiatrists here at Phoenix Children's Hospital, and she runs the inpatient unit. So she's well-versed in how to take care of yourself in the midst of all kinds of other stressors. One second for technical issues. Thanks. And that is Rochelle, who is our wonderful AV person who's helping us out with this craziness of being in the Wellness Center. So with that, I'm going to turn it over to Dr. Bachini.
Hi guys, and thank you for listening in. So like Dr. Yoblonski said, we just wanted to take this opportunity to talk to everyone about taking care of yourself. So here is our disclosure statement. Per usual, no one's giving us any money to do this, but we are happy to do it anyway, and we have no conflicts. So we're going to take some time to talk about pandemics and psychological impact of pandemics on healthcare workers and first responders. We're then going to go into strategies for identifying when you need to take a break and how to de-stress, and then talking about when you should seek professional help. And then, like Dr. Yoblonski said, Kristina is going to come and talk about all the things that are available here at PCH and how you can access them as well. So if you have questions throughout the presentation, please feel free to write it on the chat function, because we're going to leave a lot of time at the end of the presentation for the things that you guys want to talk about. So as a species, this is not our first go around with pandemics. We have lived through many of them, cholera, the bubonic plague, influenza, and we've learned a lot from these. One of the things that we have learned is social distancing works, and we've seen that happening right now as those measures have been enacted. We've also learned that this is going to end and not last forever. So it's important to take care of ourselves during this time so that we're ready when it's all over, and then can prepare for issues in the future as well. Some of the things that we learned from the recent outbreaks like SARS and MERS in response to healthcare workers is that we do see an increased prevalence of PTSD and depression and anxiety in healthcare workers who were dealing with these epidemics and pandemics on the front lines. Healthcare workers generally are more likely to suffer things like PTSD and burnout because the everyday work that we do in the absence of a global pandemic can also be very stressful and hard. They've had some research already looking into healthcare workers' response to this COVID-19 pandemic. One study came out of Singapore looking at how people responded, and what they saw was that healthcare workers who were non-medical actually showed higher rates of anxiety than those healthcare workers that provided direct medical care. And they thought maybe some of the reasons for that was not having as much of that medical knowledge to be able to say, these are the reasons I'm going to be okay. And also maybe they have less access to that equipment to keep themselves safe, like masks and other PPE, which can increase the amount of anxiety as well. Overall, however, healthcare workers have done a pretty good job in responding in the moment to this pandemic. As a bunch, we are relatively resilient, but we're not awesome at taking care of ourselves all the time. So that's another thing that we learn when we look at these situations, that drive to help others and work is really powerful. And so that it is important to take time out for yourself and really check in with your own body. So there are many things during this time that can cause stress. So one stressor is fear. So this is fear of possibly becoming sick, and also fear of getting your loved ones sick, right? So we're all basically at home with our families all the time, which is going to lead to another stressor when we are doing social distancing. But you know, it is a very real fear that if you pick something up and you're asymptomatic, which we know can happen, that you are going to go home and get the people you love sick as well. There is also work-related stress. So we are lucky in Arizona that we haven't seen the kinds of numbers of COVID-19 that they're seeing in New York and Seattle and other places. But that is not to say that there is not stress from coming to work. So aside from the fear that we talked about, there's also the stress of the policies changing all the time. When you look at the research, that's actually a big aspect of stress, because people don't do well when they don't know what they're supposed to do, right? And then it leaves you wondering, oh, was the last policy not correct? Why weren't we wearing masks? And now all of a sudden we are wearing masks. So those types of changing policies can increase stress. We also have the stress as a healthcare system of decreasing patient loads in many places. And so there's stress about job security, about decreasing salary and income. Even if we are getting our full pay right now here at PCH, you may have a spouse that's, you know, furloughed or laid off or is not making as much as you're used to. So that creates stress as well. Homeschool. So I have 3 little kids, and homeschool can be really big stressor. First of all, everyone is doing it different. So some people have an hour of work and some people have 4, and making sure your kids are doing what they're supposed to do and worrying about when they're learning what they're supposed to learn, and also just not being a teacher and having to be a teacher to your own kids can be incredibly stressful. Guilt. Healthcare workers can have a lot of guilt, and it's one of those, you know, the grass is always greener. So in places like Arizona, where there's not as many cases. When you look and see people in New York working these 12-hour shifts and they have the lines on their face from their masks, there's almost a type of survivor's guilt of, look at what my colleagues are doing. And it creates this feeling of feeling bad and like you're not doing enough. Then if you are coming to work, there's guilt about what you're leaving at home, right? So maybe it's your spouse that's doing all the homeschool. Or I know for us, that first week of homeschool, I got a notice that my second grader wasn't logging up on enough minutes to do his reading. I'm like, well, guys, like there's only so much I can do. So there's that guilt that you're not doing everything that you're supposed to do. Because again, healthcare workers are inclined to say like, I can do all of this. You want me to be a teacher and a spouse and a sister and a doctor, I got this. But that's really hard, and you end up feeling like, oh, I can't do any of this well, which creates those feelings of guilt. Loss. So there's obviously, with illness and pandemics, the loss of life. That is an incredible stressor and something to grieve, but there are many other losses as well, not just for us, but for our children and our families. So there is a loss associated with not getting to celebrate things with the people that we love. Little kids can't have birthday parties. There's a loss of normalcy and routine. So all of those things are stressors as well, because it's so different from what we used to do, and we can't celebrate and mourn and do the things collectively that we used to be able to. There can be stigma that results in stress for healthcare workers. I think we have been so lucky in that there's been such a outpouring of support and appreciation, which I think has been very moving. But you know, there's also when you have to stop by the grocery store after work, that people move even further than 6 feet away from you, right? Because they see you in your scrubs and they can identify you as a healthcare worker, and they don't want you to get them sick. And there's also the stigma that we put on ourselves, which causes a great deal of stress, that it's like a weakness to ask for help. Again, we have that tendency to just take things on, and there's still stigma sometimes associated with saying, you know what, I feel really scared. I feel like I don't know what's going on. I'm seeing things in myself that seem abnormal, or I don't know if I can do this today. And there's a lot of stigma associated with saying those things or talking about those things, which results in an increase of stress as well. One of the biggest stressors is this difficulty maintaining social connection. So as human beings, what is so protective for us is staying close to other people. And when we can't do that, that's a stressor as well. So one of the things that we'll talk about as we move on is to how to combat some of those stressors. So there is a lot to be stressed about right now. And what we know about the brain on stress is that it doesn't do that great. So I talk to our patients every day about, you know, when you go through trauma, when you're in difficult situations, your frontal lobe goes offline and you're making very primitive decisions. And that is our reaction to stress as well. So one of the things that we see is an increased focus on self, because the stress brain can go into this fight or flight response. Even if it's a milder version of that, it goes into worrying about yourself. So what's going on with me? How do I feel? What do I need? And that can make you less open to other people's thoughts and other people's needs. and what is going on with them. So you can start to notice yourself getting upset at things that you may not otherwise, like, oh, well, how come these people are working from home and I'm not working on home, right? Because there's this drive for self-protection that kicks in when your brain feels like it's in danger. You also have a decrease in rational decision making. So these can be major things. We make big decisions every day at work, so it's important to take a minute and stop and think, because your rational decision making goes down. It can also be little things. Like, I talked for weeks about, why does everyone buy so much toilet paper? Like, you don't need no more toilet paper. It's not a GI illness, whatever. And then I went to Target and bought toilet paper, and then went to Costco. And when they asked me, do you want paper towels? I was able to resist. And then they said, do you want toilet paper? And I was like, yeah, I'm going to need all the toilet paper. And I came home and I'm like, I don't know what happened. I just bought all the toilet paper I can see, because it's easy to get caught up in the global anxiety, and it decreases your ability to make good rational decisions. You could also see an increase in irritability. So the brain on stress becomes sad and irritable. And this can come out with your coworkers. It can come out with your spouse or with your children. I mean, the things that were tolerable and cute when you were at work for 8 hours and at home for a little bit, and then on the weekends, people had time to themselves. The things that were once cute and endearing are now irritating, right? So you just have to, again, be mindful of that. And there's also a tendency to get tunnel vision on the negative things that are happening and really focus on that. So when you're working through that lens of stress, you have a tendency to say, oh, well, this is another bad thing that's happening, and this is another bad thing that's happening, other than taking time to pause and think about all the kind of positive things that continue to happen and focusing on that. So when we talk about what is protective, the biggest thing is relationship. These are some of the other symptoms that you might see other than the ones we talked about with your brain being in stress. So there's physical symptoms that come with stress. There's cognitive symptoms. You may feel like you can't concentrate as well as you used to, or you get confused more easily, or just forget things that you might otherwise remember. Certainly the psychological things that we talked about, and then behavioral. I mean, there's lots of memes out there about drinking and sheltering in place and all of that. But when you notice yourself using alcohol or substances as a way to cope what's going on, or even in your own house, you just don't really want to hang out or interact with people. If you have changes in appetite, you're eating much more than usual or much less than usual, these are things to just take note of and be mindful of, because your body is sending you a signal of like, hey, something's not right here, something's different. One of the things that we see when people are under stress is that, like, there are all these different ways that people can manifest stress in their bodies, people also respond differently to that stress. So when you look at the research, some people come out of really stressful situations with more resilience. They actually have learned skills during that time that help them to face future negative situations. So if you take that stress and acknowledge it and deal with it in a constructive way, you can build positive outcomes. One of the most important ways to do that is through social interaction. So although we have to stay socially distant, it's important to continue to be emotionally connected. So continuing to be able to share things with people, to talk to people. The online platforms have been really helpful in this. So having Zoom conversations or Skype or FaceTime with friends and family is going to be really important. So these are pictures of people doing just that. So the one on the top left is actually, the bottom three are my little kids, and that is a Zoom play date that we are having with my best friends from high school who were in San Francisco and Pittsburgh, right? So that opportunity to get together and share things with people. There's lots of ways to celebrate birthdays. So this is from a birthday parade. So that is something that's kind of popped up for kids and grown-ups, where friends just make signs and get balloons, and the family stands in their driveway, and you have a birthday parade and drive by and wish them a happy birthday, because people can't have parties anymore. It's also important in your own home to continue to stay connected. This is a perfect time to play Monopoly, which takes 3.5 hours with your children, right? So to kind of veer away from just being on your cell phone or watching the TV, and actually doing stuff with your kids. Turns out kids really like that. So our kids, I know, are really into it. We've played a lot of board games lately, but even just connecting with your significant other, or calling your parents, or doing those type of things that keep you emotionally close. We could even go back to doing things like writing letters, which seems super romantic right now, right? But those kind of things that keep us connected as people are really important. And I think societally we've done a good job. I know Disney last weekend did a sing-along, right? Where you get together and sing songs together. And so seeking those things out actively and making sure you're spending time with those that you love, even if it's just virtually. Also, talk about it. So one of the things that we have been doing is going on walks. And this little picture is a sidewalk drawing that some little kid in my neighborhood did. So often we think if we don't talk about it, it's like it doesn't exist. So if we don't talk to our friends and family and significant others about our stress, or if we don't talk to our kids about our stress, they're just going to think that we're not stressed. But this is such a big deal. It's changed the way we live our lives so much. Everyone knows. And so not talking about it will actually make it worse, because one, it makes you feel isolated, like you're the only one that's feeling this way. And it increases your level of stress because you don't have a chance to share it. So it's really important to, at work have a buddy, or at home use your spouse or someone that you're close to just sit down and say, hey, things are super different. How are you dealing with that? How do you feel about it? And just as important as starting the conversation is being present in listening to the answers. I think we have a habit of saying hey, how are you? And then we keep moving. But I think it's important, especially in times like these, to say, how are you? And just pause and wait for that answer and really listen to what the other person has to say. And if they don't want to talk about it, that's okay. Don't, force people no, things are really horrible. I insist that you tell me how stressed you are. But, you can share your own thoughts and feelings about it. It's okay to feel scared. It's okay to feel anxious. And the more we talk about those things and normalize those things, the more we can help ourselves and help each other. For people that are living alone, or people that are far from you, it's important to call and check in with those people, because they probably have to talk too. Certainly on major anniversaries of things, so people's birthdays, people's passings, times that are significant for others, call them, talk to them, reach out to them. And it's okay for times when are going to be periods of high anxiety or stress for you, that you tell people, hey, Thursday is the anniversary of my dad's death, and it's going to be really hard to be alone. I need someone to talk to. Those things are really important to do, and in the long term, they are really good for your mental health and build that resistance piece. In addition to those two biggies, here are some other strategies for self-care. The media exposure is a big one. There is a lot of media exposure. Some of it is very sensationalized. I mean, 24/7, the coverage is about COVID. So it is important to know what's going on, but you don't need to have that on all the time, because then your brain gets overloaded with all that information. So I would encourage you to pick maybe one or two sources. For those of you that work at PCH, this should be one of them, right? Because it's important to know what's going on at work. But pick one or two sources and listen to them maybe once a day, maybe a couple times a week, so that you're informed but not oversaturated with what's going on. The same is certainly true for kids. You want to make sure what they're hearing is appropriate to their developmental level and not excessive. One of the things that's a really huge protective factor for healthcare workers is that we came into this field for a reason, and there's incredible purpose in that, and that is very protective. So when you find yourself having some of that symptomology, when you're not sleeping as well, when you're irritable, take a moment to think about why you are doing this in the first place. Why you chose this profession that puts so much of yourself out there, that you're, here when so many other people are at home. But a lot of us have very personal reasons and altruistic reasons for going into the fields we've chosen to go into, and that is still our purpose. So it's important to kind of check in with that and be mindful about it, because reminding yourself of that will help you stay centered and focused. It's also important to set healthy boundaries for yourself. So in the era of working at home, some people, have difficulty getting stuff done at home, but the tendency when talking to people is that people actually are working more. Now you're taking phone calls for longer, you're doing meetings for longer, you're on the computer for longer, and it's important to be mindful of that, because you have to be disciplined about taking time for yourself. And saying, if my workday is 8 to 5 or 7 to 4, whatever that is, I am going to work during those hours, and I'm going to take time for myself and my family. So those boundaries are very important. It's also important to tell people what you can and cannot do. If you have relatives back in New York and something, horrible has happened, it's okay to come to people and say, hey, I'm having a lot of difficulty today. This is what I can do, and this is what I can't. I mean, again, a lot of times for people in healthcare, that feels like weakness, but kind of the inspiration for the theme of this talk is we can't help anyone when we are not in a good place. The stressed brain that's irritable and sad and not making good decisions and buying all the toilet paper at Costco is not able to efficiently and effectively take care of others, right? So that kind of leads into the being patient with yourself. If there was no global pandemic and you were asked to all of a sudden become a teacher to multiple grades, that would be stressful. If there was no global pandemic and you were told that you were going to have to be waiting in line at Trader Joe's to get your groceries, that would be stressful. If you were told under normal circumstances that you were just going to be at home when you're not at work and can't go to a concert or a movie or a restaurant, it would be stressful. So doing all of these things in the face of a global pandemic is supposed to be stressful. So be patient with yourself, be kind to yourself, and be patient with your coworkers and loved ones and children, because it's stressful for everyone. So you don't have to be the perfect school teacher. If you're having a day when you're like, we're going to hang out in our pajamas today and that's what we're going to do, that's okay. When I got that email about the reading, I actually wrote back and said like, hey, we're doing the best that we can. Like maybe we'll have to do some of this stuff on weekends because my husband and I are both still going to work and it's really hard for us to get all this done during the week. And everybody gets that. So giving yourself that kindness is really important. And then all of the stuff that we would normally encourage, right? So while we still can here in Arizona, get out and walk, get some exercise. Kristina will maybe talk about, there's tons of things that people are offering. You can get a lot of cool platforms and apps and things that you couldn't before now because people are being so generous and kind. So take advantage of those things. Sleep well. Sleep is very important. So again, try not to get caught up in, watching the news till late at night or those types of things. And nutrition, healthy nutrition is always important. These things will help your physical body and your immunity and your response, but it will also help your emotional and mental health as well. If these things get so overwhelming that the strategies we're suggesting aren't helpful, if you start feeling hopeless or feelings of worthlessness, if the sadness or anxiety becomes so overwhelming that you can't take care of yourself anymore, you can't take care of other people, please seek help. There are a lot of resources available for that too, but it's important to check in with yourself to see when that's happening so that you could seek out those resources. Certainly if you're having thoughts of hurting yourself, thoughts of hurting other people, seek help from a professional. If you have panic attacks, if you have feelings of doom or you're short of breath or you're avoiding going places because you're afraid that you're going to panic and not be able to escape, please seek help. I would always err on the side of seeking help. No one is going to fault you for going to talk to someone. I think that's always important to do, but especially be sure to pay attention to some of these signs and symptoms to seek someone out to go talk to. So with that, I'm going to turn it over to Kristina, who is going to talk to you about all the amazing things that we have here to help you with some of what we've talked about so far.
Thank you, Dr. Bachini. Well, good morning, everyone. I hope that this presentation finds you well. I am looking forward to talking to you about some of the wellness programs that we have for you to help you during this very interesting time that we are going through right now. So at the beginning of this crisis, we were inundated with information. There were so many things coming at wellness and so many things coming at innovation and learning. It was kind of hard to navigate. So what we tried to do is actually talk about the top 5 things in this particular slide. First of all, it is, if you're feeling like you need a little additional assistance or some time to talk to someone, know that we have Cigna EAP. It's available 24/7. I highly recommend calling or visiting the website because there is someone available at any time to help you, to navigate you through that system, to get you the assistance that you need. And also, Cigna EAP is more than just going someplace to talk to someone else for maybe some help or some advice during this time. You can go there for legal counseling, child care. There's a lot of things that Cigna EAP offers beyond just a place to go to in times of crisis, but we do want you to access it if you need to. When you go into Cigna EAP or call, you want to make sure that you're using your employer ID, which is PCH. Know that also Cigna is working with us on bringing more things on site for you to make it more convenient for you to access their services that they provide. You can also do telehealth through Cigna Medical. We have 2 telehealth vendors, and you can access them again through mycigna.com or download the MyCigna app. And you can find them under Find Care on that particular app. 401k. You may have some 401k or some financial questions going on right now. Know that Fidelity is available for you. They have advisors. You can call them. You can visit them online. And they're here to answer any questions you may have about your investments during this time. And remember high fives. that connectivity to one another. If you go on the PCH4U portal, which we're going to visit in just a moment, you can actually click on the High Five tab and be able to send kudos and I'm thinking about you to other, your coworkers and other people in the organization that you may think needs a little bit of boost. And again, if you have questions, we're going to visit the PCH4U website in just a moment. There's tons of information out there that maybe fits what you're looking for in the moment. There's innovation and learning, benefits, and the wellness pages provide a ton of information and resources that you have at your fingertips. So one particular app that we do want to talk about is Headspace. Headspace, if you haven't downloaded yet, I highly recommend doing it. Headspace is a meditation and a mindfulness app that normally costs $144 for a subscription a year. We found that Headspace was so important that we went ahead and paid for that for you. So you can go on, and I'm going to show you in a moment how to do that. Download the app, register with Headspace using your Phoenix Children's email address, and that is how you can get your subscription at absolutely no cost. It goes over a lot of the topics we talked about earlier today. There's a meditation component to it. There's a wake up. If you're going through difficult times or you have difficult questions, this is a new feature they have. You can click on, watch some videos. There's also move mode. So you can go do some stretches, get some exercise in. And they also have a fantastic sleep part of their program that you can access as well, where you can listen to certain sleep sounds. Also about Headspace, there's a kids component that's fantastic. So go in, play around. Remember that this is absolutely free for you. And again, the information is posted on PCH4U. I'm going to show you how you can get to that fairly quickly and access that information and download that app. We also have a lot of virtual programming going on right now. So breathing and meditation is led by our social workers and Dr. Lara on education. That is Monday through Friday, 12:15 to 12:30. There is a Zoom link. You just click in and then you're able to go through some breathing or meditation that'll help level set you for the day and get you grounded. Innovation and learning, there's multiple learning opportunities that they're offering right now. A lot of webinars are going on. I highly recommend going to their page, finding out their information, because there may be a topic that you're really interested in, it's relevant to your needs in the moment. And coming soon, we actually just launched yoga, virtual yoga with our instructors that teach at Phoenix Children's. That is on Fridays from 1 until 2 o'clock. That information will be posted soon on PCH4U, and you'll be able to, again, click in and participate with your coworkers in a virtual yoga class. Same thing with Pilates and Zumba, and they're all with our PCH instructors. And we all know that our pet therapy program here is phenomenal. And Annie and the other pet therapy dogs have not been able to come out and interact with us. So they are also doing virtual pet therapy that will be starting in the next couple of weeks. And you can see them 12:30 to 1 on, I believe it's going to be Tuesdays and Thursdays. That information will be posted soon. I do want to remind you also about the Wellness Center. If you happen to be on campus, know that the Wellness Center is still open. It is open 24/7. You can come in, you can run on a treadmill. We have our bikes, there's places to stretch, to do your own, there's free weights in here. And then of course we have our relaxation room. There's 3 massage chairs, 2 recliners. You can just come in, kind of chill, just make sure to wipe everything down, and we do limit our amount of people to 5. So come visit us in the Wellness Center because we're here for you. What I'd like to do now is to show you how to navigate through PCH4U, because we all know that can be a little stressful at times. So when you go to PCH4U, you have options. You can go up to the search bar right here. You can type in benefits, innovation and learning to get a variety of different information out there, or you can just click on this briquette. If you click on the briquette, it's going to take you right to the wellness page. Here we have listed a special COVID page right there that talks about different support systems that we have. We have the high five, we have physical, mental, and emotional. These are also found over here, the topics or the categories under our pillars right here. So you can click on any of those at any time, and it'll take you to your particular page that you're looking for. So today we want to see how to get to Headspace. So I'm going to choose emotional, and then it pulls up our emotional page. If you come to the briquette again, click on Headspace, you'll be able to go right to the website. Here's where you're going to go up and join, or you can just log in. And again, it's really important to use your Phoenix Children's email address. If you don't, they're going to ask you to pay. So make sure that you put that in and you'll get it at no free. So this is what Headspace looks like. So when you log in, you'll be right, takes you right to the page. And right now I am working on a balance meditation, but there are so many different things that you can access here. There's balance, self-esteem, letting go of stress. If you go to the Discover page, there's singles, there's packs, there's kids, there's animation. There are a lot of options, and you can it just guides you through all of these different types of meditation, mindfulness practices. If you look on the left-hand side, there's the foundations, happiness, work, performance, student. There's just a fantastic website, again, at no cost to use. So that is just how you can, there's a sleep component. Headspace is just a really great program, and I really hope that you take advantage of that. What I'd like to do now is to help you get grounded and balanced in the day is have Dr. Lara come, and she's actually going to guide you through a grounding and a balancing meditation breathing exercise.
Thanks, Kristina. Thanks, Funda. So we're just going to do this real quick for those of you who have some control issues, not like me. We're going to just do probably 3 minutes, and it's just something for you to try, and then we'll get to questions and answers. So now we're going to take a few questions, and to start things off, Dr. Bachini, I have noticed the first couple of weeks I was super hypervigilant, activated, ready to go. I was learning vent settings, and now I have crashed big time. So what's going to kind of be a way to normalize and stabilize for the long haul in this, because it looks like it's going to be a much longer process than we all thought it might be?
I think originally there was a lot of anxiety about kind of the potential of like reassignments, right? Like there were rumors going around about like, you know, we're really gonna have like child psychiatrists treating adult patients. Like that probably would have been a bad idea. So I think we were all kind of under this increased stress. I think you really go back to the things that are going to be part of our everyday routine as we go forward, which is kind of all the basic stuff, right? The social distancing stuff, unfortunately, I think is going to be less, but it's going to be different forever. So kind of getting accustomed to those types of things. You know, we're not going to be like hugging and shaking hands every time we meet strangers. Let's don't have strangers, but you know, we are going to be coming up with other things. The hand washing that is actually really good. So in some ways, it's going to change life for the better, like infection control for the better. For example, when the AIDS epidemic happened, right? It made huge moves forward in protection during sex. And that was a big deal. And I know, even prior to this, we had the hand washing campaigns. I mean, not just at PCH, but everywhere in hospitals. It was kind of hard to get people to wash their hands as often as they should. And now we're doing that all the time, right? So focusing on those simple things that are going to last for a long time, I think is important. And I think it's okay to let go of the worries about events and that stuff, because hopefully we don't get there.
A lot of people have mentioned feeling guilty that we are not having more to do right now. What would you say to that?
Yeah, I mean, I think that's a big one. That's one where I felt as well, because the community is doing so much for healthcare workers. Like, I went to Costco and my husband's like, well, did you go to the front of the line? I'm like, no, I didn't go because I'm not seeing any COVID patients. Why would I go to the front of the line? And even he is an emergency, an adult, and has seen some, but not that many, so there is that feeling of we're not doing enough to help out our colleagues. But I think it's important to focus on what we are doing, because the hospital in general did a lot to get ready for should there be an increase. And, there are still people that are sick that need to be taken care of. And we're doing that. I think it's really an important time to take care of ourselves and each other as well, so that when things do pick back up, we're ready to do that, because there is going to be kind of a re-entry that happens. So all of a sudden when our volumes pick back up, to be ready to engage in that, and then know that we are doing our part already by social distancing and by spreading the word. I mean, some of what we're doing is providing public education, right, about this to people. And so there are things that we're already doing, so to focus on those. And if you know people that are having higher volumes and cases, doing things to help them. So if you do have extra time to reach out, I know we have colleagues here at PCH that have gone to New York, right? So just even calling those people, sending support, doing what you can to help people physically and emotionally.
Looks like we've got a little bit of time. If you have any questions, please feel free to put them in the chat section. And then I will continue asking you some other questions that we have. The other thing that people have been noticing and commenting on a lot is that everybody seems to be having different stress level days. How do we not necessarily take on their stress, but be there for them? If it's a day where, I don't know, the mask policy changes and it's triggering people, what would you do for coworkers?
I think the first thing is to acknowledge. Most people under normal circumstances are going through a bunch of things that we have no idea about. So especially when we are under stress, our initial reaction is to personalize it, like somehow this person's anger or upset is like related to me in some way, when it's not. So first I would recognize that, like, hey, this is about what's going on with them. And then asking about it, like, hey, like, you seem stressed, or is there anything going on that I can help you with? Or, hey, what's going on with you? How are you feeling today, right? That's a big question that we don't ask each other a lot, because when you just say, how are you, and leave out the feeling, the answer is fine, right? I'm fine. But when you ask someone, how are you feeling today, that sometimes elicits a different response. So it's important to approach people in a non-judgmental way. And if they say, yeah, no, everything's fine, I don't need anything, you could say, okay, so if you do, I'm here. Because I know for me, like, I don't know what to do about my mask now. So I'm going to look into that. And like, if you need anything, let me know. I'm here for you.
Well, being at home with your family is a joy. It's been a joy for 3 weeks now. Any suggestions or thoughts for people, especially who are working from home, maybe, about what they can do to continue the movement forward with everybody instead of everybody getting on each other's nerves?
Yeah, I mean, as much as you can, again, when it's nice outside and stuff, to like go on walks, to take care of yourself, those things become important. And again, it's important to just kind of call it what it is. I mean, you can say to your spouse, like, hey, like, I need 5 minutes, and acknowledge that it is hard for everyone to be home at the same time. So, you know, I always talk about how lucky we are here in Arizona that like the weather has been so nice and we can kind of get outside, or at least like sit outside. I mean, when I did that video chat, my friend in San Francisco was in like an 800 square foot apartment with her husband and kid, and it was raining outside, right? So it's very important, and we're lucky that we can take some space and like go outside or go on a walk and do things like that, and to say like, hey, I'm sorry, like, I know this probably shouldn't be getting on my nerves, but it's stress and I am. So like, I just need a minute for you to do something else. And if you do make a mistake, I tell parents all the time, like, make a repair. Like if you do something that's uncharacteristic or you wouldn't normally do, it's important, especially with kids, to go back and say, hey, like, I made a mistake and I'm sorry, because then you're modeling for them. Everyone makes mistakes and that's okay. And this is how you repair that when it happens. And that's awesome. I mean, kids need to learn that too.
I've heard a lot of people commenting that they feel like they're not doing anything well. And I, as a pediatrician, have just been saying, sometimes you don't have to be the perfect parent, you just have to be there. Any other advice for not perfect parenting?
Yeah, so no one is a perfect parent. That is impossible. There's no such thing. I know that like my friends always get really excited when I tell them, like when I like freak out, you know, at my kids or whatever. It's they're like, oh good, if you do it. And I'm like, yeah, everyone does that, right? So it's okay. Again, I think that social connection becomes really important, because when you put yourself out there and say, hey, I did this, then other people are like, oh yeah, me too. I did that like 5 times last week. And so talking about it is really important, and reducing expectations for yourself and the people around you at home. So it is really hard for your 3rd, 4th grader to sit for 3 hours and do coursework at home, right? That's different for them too. So it's not going to happen that way, and that's fine. Just reminding yourself that like you are doing the best that you can. And when you notice the household is under stress, you like, if you're the teacher, you're also the principal. You can be like, we're shutting this down today. We're not doing this today. We're taking a break. There's a lot kids can learn in playing with their parents, right? I talk about things like, you know, cooking. If you're baking, baking is math, baking is science, right? Home ec, it's all of those things. So do those type of activities. And when you feel like the kids need a break, if the kids are really acting like they need a break, you probably need a break too. So it's okay to do that.
Anything else you'd like to wrap up with?
I don't think so.
Okay. Well, thank you all for joining us. Again, if you have any questions, please reach out to any one of the 3 of us. And absolutely know that there's all kinds of people here at the hospital that are wanting to help. So just reach out, and hope you guys have a great day.